वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
Which of the following should be administered to a patient with tuberculosis who is on isoniazid therapy? A. Thiamine. B. Riboflavin. C. Pyridoxine. D. Nicotinic acid.
The correct answer is option C, pyridoxine. When a patient is undergoing isoniazid therapy for tuberculosis, it is important to supplement with pyridoxine, also known as vitamin B6. Here's why. 1. Isoniazid, the medication used to treat tuberculosis, can lead to a deficiency of vitamin B6 in the body. 2. Pyridoxine plays a crucial role in various bodily functions, including the metabolism of proteins, fats, and carbohydrates. It is also essential for maintaining a healthy nervous system. 3. By supplementing with pyridoxine, potential side effects of isoniazid, such as peripheral neuropathy, damage to the nerves, can be prevented or reduced. Therefore, to ensure the well-being of the patient and minimize the risk of complications, it is recommended to administer pyridoxine alongside isoniazid therapy.
Which of the following surgical procedures is a sitz bath commonly recommended for? A. Appendectomy. B. Hemorrhoidectomy. C. Cholecystectomy. D. Mastectomy.
The correct answer is option B, hemorrhoidectomy. A sitz bath is often recommended after a hemorrhoidectomy, which is a surgical procedure to remove hemorrhoids. Here's why. Soothing effect or relieving effect. The warm water provides comfort and reduces pain, discomfort, and inflammation. Promotes healing. The improved blood flow to the area helps in the healing process and keeps the surgical site clean. Relieves symptoms. Itching, swelling, and irritation in the anal region are relieved by the sitz bath. Improved hygiene. The sitz bath helps maintain good hygiene by keeping the area clean and preventing bacterial buildup. In conclusion, a sitz bath is recommended after a hemorrhoidectomy to provide soothing relief, promote healing, relieve symptoms, and maintain proper hygiene.
The most effective way to break the chain of infection is A. Hand hygiene. B. Wearing gloves. C. Placing clients in isolation. D. Providing private rooms for clients.
And the answer is option A, hand hygiene. A hand hygiene, most effective way, removes germs from hands, prevents spread, wash with soap or use sanitizer. B, wearing gloves, provides barrier, not most effective alone, where when in contact with fluids or surfaces, hand hygiene still necessary. C, placing clients in isolation, important measure, prevents spread of highly contagious diseases, not applicable in all situations, doesn't address overall prevention. D, providing private rooms for clients, minimizes transmission, increases privacy, reduces exposure to infectious agents, doesn't address essential preventive measures.
False sensory perception in the absence of real external stimuli is called A. Illusion, B. Hallucination, C. Deja vu, D. Depersonalization.
Hallucination is the correct answer, option B, because it involves false sensory perceptions without real external stimuli. Hallucination occurs when an individual experiences sensory perceptions that are not based on reality. It can affect any of the 5 senses: visual, auditory, olfactory, gustatory, and tactile. Now, let's move on to the brief descriptions of the other options. A. Illusion. Misinterpretation or distortion of real external stimuli. Perception differs from the actual properties. Examples include a mirage in a desert or optical illusions in magic tricks. C. Deja vu. Feeling of familiarity with a new situation or event. Strong sense of having experienced it before. Subjective experience, not a false sensory perception. D. Depersonalization. Feeling detached or disconnected from thoughts, emotions, or body. Sense of being an outside observer of oneself. Primarily a disturbance in self-awareness, not a false sensory perception. Option B, hallucination, is correct.
And for additional query, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.